A one-day seminar on the institutionalization of the birth spacing paradigm in Khyber Pakhtunkhwa was organized by the project on Monday, February 6, 2012. It aimed to provide a comprehensive briefing on FALAH's communication, advocacy, and mobilization strategy, and IEC and training materials, and discuss how best it can be utilized in the future. Each seminar has two distinct objectives: to make FALAH's birth spacing message sustainable and prioritized at the national, provincial, and district level, and to help develop strategies, identify resources, and prioritize timelines. The morning session focused on FALAH's communication strategy and products, with Dr. Ali Muhammad Mir, Chief of Party of the FALAH project, delivering the welcome remarks and providing an overview of the project. Dr. Ali's presentation was followed by contributions from colleagues who have been an integral part of the project. Dr. Arshad Mahmood, Director M&E, Dr. Gul Rashida, Senior Director Training, and Ms. Simi Ashfaq, Senior Program Manager. Mr. Javed Jabbar, ex-Federal Minister and Member of the Senate and Chairman of JJ Media Private Limited, gave an introduction to the FALAH Communication and Social Mobilization or CAM strategy, its products, and the background to the information, education, and communication materials developed by the project for promoting the birth spacing agenda. Contributions from the beneficiaries form an important part of the event, and the seminar in Peshawar was no exception. This CBV, part of a husband and wife team from Mansehra, spoke at length on how the training and audiovisual material developed by FALAH has made her job easier and helped her win over the women of her community to the concept of birth spacing. The ulama have also proved instrumental in obtaining a buy-in to the birth spacing concept. This has been made possible by obtaining a consensus of all reputed ulama from all the schools of thought regarding the Quranic injunctions on family well-being. FALAH has put in a very successful mobilization campaign which has trained more than 1,500 local religious leaders. Qazi Wasiur Rahman is one such religious leader who spoke enthusiastically about the concepts he has learned and how incumbent it is on all of us to make the message sustainable. The USAID representative, Dr. Munir Afridi, informed the participants that maternal child health and family planning are the priority thematic areas within the health sector, and USAID will continue supporting similar projects, which are aimed at improving the health and well-being of the people of the province, Pakistan in general, and mother and children in particular. The chief guest at the opening session, Dr. Noorul Iman, Special Secretary Health, Department of Health, Government of Khyber Pakhtunkhwa, spoke on the importance of birth spacing and the positive impact of the FALAH project in the province. He acknowledged FALAH's contribution to Pakistan's family planning debate and highlighted proposed efficiencies in the setup of the provincial health department by making it more integrated and knowledge-orientated so future policies are evidence-driven. The use of FALAH's IEC material, Dr. Iman stressed, would be in the forefront of this new initiative. The Director General, Department of Population Welfare, Mr. Noor Nawaz Khan, echoed the Special Secretary's thoughts and also thanked FALAH for organizing the seminar, as it had brought together the stakeholders who can bring about change the project has envisaged by scaling up the mobilization activities. The afternoon session is where we ask the participants for their input. How best to obtain the required buy-in from the relevant provincial departments for the adoption of available, tried and tested products and the development of strategies. A group work exercise was carried out with 6 groups representing the Health and Population Welfare Departments, the LHW program, the MNCH program, Peshawar-based NGOs, and training groups from the Health and Population Departments. Each group was given the task of outlining an action plan on how best to integrate FALAH's IEC and training material into their department's communication strategies for the future use. The action plans were then presented by the group leaders and discussed at length by the participants with contributions from all present. The seminar concluded by a vote of thanks from Dr. Shabina Raza, Director, Department of Population Welfare, Government of Khyber Pakhtunkhwa.